Comparing paranoia to schizophrenia. Paranoia and schizophrenia are two distinct mental health conditions, but they can share some similarities in terms of symptoms. Paranoia is a symptom or feature of various mental health disorders, including paranoid personality disorder, delusional disorder, and schizophrenia. It involves an intense and irrational distrust and suspicion of others, leading to a belief that one is being harmed, deceived, or persecuted. B. Schizophrenia. Schizophrenia is a chronic and severe mental disorder characterized by a combination of symptoms, including hallucinations, delusions, disorganized thinking and speech, and impaired social functioning. (1) Excessive distrust and suspicion of others, even without evidence. 2. Belief that others are plotting against or persecuting them. 3. Feelings of being watched, followed, or monitored. 4. Difficulty trusting and forming close relationships. 5. Hypervigilance and constantly being on guard. 6. Strong emotional reactions to perceived threats. B. Schizophrenia. 1. Hallucinations, perceiving things that are not there, most commonly auditory. 2. Delusions, firmly held false beliefs, such as delusions of grandeur or persecution. 3. Disorganized speech and thoughts. 4. Disorganized or abnormal motor behavior. 5. Catatonia, motionless state or excessive, purposeless motor activity. 6. Flat affect, reduced emotional expression. 7. Reduced motivation and lack of interest in activities. 8. Social withdrawal and decreased ability to engage in relationships. 9. Anhedonia, inability to experience pleasure. 10. Reduced speech and difficulty in initiating and sustaining activities. 3. Relationship of paranoia and schizophrenia. Paranoia and schizophrenia can coexist. Paranoia can be a prominent symptom of schizophrenia, particularly in the paranoid subtype. However, not all individuals with paranoia have schizophrenia. Paranoia can also occur as a feature of other mental health conditions, such as paranoid personality disorder or delusional disorder. It is important to note that a comprehensive evaluation by a mental health professional is necessary to accurately diagnose and differentiate between these conditions. The treatment approaches for paranoia and schizophrenia may also differ, so appropriate interventions should be tailored to the specific needs of the individual. Other types of personality disorders. These are the other types of personality disorders recognized by the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. 1. Borderline personality disorder, BPD. Characterized by instability in emotions, self-image, and relationships, along with impulsive behavior and intense fear of abandonment. 2. Antisocial personality disorder, ASPD. Associated with a disregard for the rights of others, a lack of empathy, and a pattern of engaging in manipulative, deceitful, or criminal behavior. 3. Narcissistic personality disorder, NPD. Involves an excessive preoccupation with one's self-importance, a need for admiration, and a lack of empathy for others. 4. Avoidant personality disorder, AVPD. Marked by feelings of extreme social inhibition, fear of rejection, and a pervasive sense of inadequacy, leading to avoidance of social interactions. 5. Obsessive-compulsive personality disorder, OCPD. Characterized by a preoccupation with perfectionism, orderliness, and control, along with rigid adherence to rules and routines. 6. Histrionic personality disorder, HPD. This manifests as excessive attention-seeking behavior, dramatic and exaggerated emotions, and a strong desire to be the center of attention. 7. Dependent personality disorder, DPD, involves an excessive reliance on others for decision-making, reassurance, and approval, accompanied by a fear of being alone or abandoned. 8. Schizoid personality disorder, SPD, characterized by a pattern of detachment from social relationships, limited emotional expression, and a preference for solitary activities. 9. Schizotypal personality disorder, STPD, associated with peculiar beliefs, eccentric behavior, and difficulties with social interaction, often resembling milder forms of schizophrenia. It's important to note that personality disorders are complex and can vary in severity and presentation. Diagnosis and treatment should be carried out by qualified mental health professionals who can assess an individual's specific symptoms and provide appropriate support and intervention.